Having an antimicrobial stewardship program in a practice is very beneficial in helping you to make correct decisions about how you want to treat patients. So for example, a part of an antimicrobial stewardship program is the development of antibiotic use guidelines, and those can be very specific to your hospital. So what are the types of infections in patients that you're seeing routinely that you need to have guidelines so everybody's on the same page about how we treat an infection?
Our antimicrobial stewardship program can put together data from our active environmental surveillance. We also have clinical isolates from the patients here in the hospital, and we have antimicrobial use data, so what the clinicians are prescribing to treat those. We can put all those together and see where are we using maybe more antibiotics than we need? Are they being applied effectively? Are we choosing the right antibiotic? We want to make sure, again, that we have the correct drug, the correct duration, the correct dosage, so that we don't wind up with those nosocomial infections that are difficult to treat.
As a microbiologist, we receive many different cases in the lab with infections. On many cases, some of these infections are associated with bugs that are considered multi-drug resistant or superbugs. So in those cases, we get in troubles and we need to discuss with the clinician and we need to talk with the pharmacist trying to help to find the best medication. So if we don't fight these multi-drug resistant bugs, it's going to become more and more difficult to find good therapy for our veterinary patients.
So we can use the data that we get from our environmental surveillance and pair that with what we're actually seeing in the community. So this is where it can be really helpful to have assistance from a microbiologist or to have contact with somebody at your regular laboratory who is doing those cultures for you to help identify some of those resistant infections.
If you do not have a program in place to where you're actively monitoring your antimicrobial use and your empirical therapy options, one thing you can do to help this is take a timeout. So an antimicrobial timeout is where after 48 hours to 72 hours of therapy, you stop and review the patient. You critically think about whether the patient needs to continue on this antibiotic, and you review if you have culture insensitivities back. So if you have cultures and sensitivities, at this timeout, you decide whether or not we stop or change therapy. When acting as a steward, you should have restriction statuses for your antimicrobial agents. This is important because these restriction statuses help us preserve critically important antibiotics. Restriction statuses are important because they help preserve the use of antimicrobial agents. When you're thinking about assigning restriction statuses, you generally have three categories. There's unrestricted use, which allows you to grab these antimicrobial agents as your first choice. You have restricted use, which you should be reviewing with another team member and critically assessing before use. And then protected use antibiotics. Generally, the protected antibiotics are a part of the top 5 critically important antibiotics for human health care as defined by the World Health Organization.
Using those kind of smart decisions, I think long-term can help improve our patient care. So we hope to provide kind of the gold standard of care for our patients, and by using antibiotics judiciously, we can achieve that goal.